My name is Hannah Myers, and I'm going to be giving an informational speech on CPR. Who knows what to do in an emergency case where CPR may be needed? Cardiopulmonary resuscitation, also known as CPR, is a life-saving technique that can make all the difference if performed in ample time and performed correctly. I have been through 2 CPR classes and practice regularly on a mannequin in my health science class. Important questions are, in what cases is CPR used for, how do you perform CPR, and what are the risks? In what cases is it necessary to perform CPR? CPR is useful in cases of an emergency such as a heart attack, near drowning, cases where the heart stops or apnea occurs. Dr. Mary Williams explains agonal breathing sounds like gurgling or gasping, but it is not breathing. According to CPR.heart.org, immediate CPR can double or triple chances of survival after a cardiac arrest. How do you perform CPR? The basic CPR is 30 compressions to the chest followed by 2 breaths. But before you begin, you always need to check your surroundings. Make sure it's safe, because if it's not safe for you, well, that's not good. So I will demonstrate how to perform CPR. During your 30 compressions, you want to go right between the breastbones, just a little down from the nipple line. You don't want to go too far because that's your xiphoid process, and that'll be a risk we'll talk about later. You want to use the bottom part of your hand, so it's always good to just kind of like wrap one over the other as so. And you want to be over the victim so you can get a good compression. And you're going to do 30 compressions to 2 breaths. And I'm going to use the ambu bag for the 2 breaths. So you go in about 2 inches. So you do it about, and it's kind of a fast pace. So. Then you're going to get your ambu bag, or in some cases, one might not be available. And you're going to tilt the head back, called the head tilt chin lift. Lift the chin up so airway is open. And 2 breaths. Then you're going to begin compressions again. Head tilt chin lift. And you're going to do this for about 2 to 2.5 minutes. It's normally about 5 cycles, and you're going to want to check their vitals again. You check their vitals normally by placing 2 fingers at their neck to check their pulse. You want to lean in to listen for breathing. If they are still responsive, then or if they are still unresponsive, then you're going to continue doing CPR until EMS arrives. If they are responsive, you want to stay with them and continue to check their vitals until EMS arrives. Okay. The risks during CPR, like I explained, if you do compressions too deep or you're too far down, it can cause damage to the lungs. Also, if they regain consciousness, regurgitation is a possibility. So if they start throwing up, you always want to turn your victim on his or her side so they throw up out and they don't, choke on their vomit. So those are the risks involved. In conclusion, now that you know in what cases CPR is performed, how to perform CPR, as well as the risks involved. I hope that y'all are more prepared during an emergency case where CPR may be needed.
Great job!
My voice got real shaky there.